First of all, just a brilliant question, and Robert and other panelists for kicking us off. And really just a couple thoughts to further frame. From the seat and office that I've been in, I've had the real privilege of interfacing and having discussions with different groups, whether it could be private equity or venture capital, and then, of course, the more traditional development partner. And each has their own metrics of what they may be looking at, whether it's looking at some sort of financial return, or again, as mentioned from our office, that return has been traditionally the impact. And one piece I just put out there is also appreciating that we also may need to consider how we look at traditional metrics and how we look at traditionally we may be investing. And I'll give it a classic example of having a discussion fairly recently with a venture fund that's been looking to put investment into the African continent around private health sector and SMEs, and also some of how they reach into the very populations and concerns we're talking about: women's health, new technologies. And from their perspective, looking at, for example, a portfolio and what is the risk. And for example, in a network of thousands of clinics or hospitals, looking at what potentially may be the default rate for those who may be getting loans or other sorts of liquidity to support their financing and their operations. And so if they see, for example, I don't want to, be stereotypical about what metrics may be for different types of funds, but if it's something that could be a default of 10, 15, even 20%, these are the sorts of numbers that are on the balance sheets that, quite frankly, will not get the traditional investments. And I share this because, from our perspective, or for those who are looking at impact, what's a very interesting model that we see is that, yes, there may be X percent default, but then looking at that significant number of clinics or hospitals or facilities that actually are not. And so the idea of the blend, or the vision of the blend, I think is illustrated there. And we've heard guarantees and risks. And this is how we work together, where perhaps we can redefine some of the metrics on return in how we use this layer cake approach, so that, again, the numbers that traditionally would have private sector or venture backed concerns who won't be making an investment, how we truly can work together in ways that when we pull our resources together, those risks do become mitigated, and that we really can make these significant game-changing investments in technologies and new models for delivery of care. Thank you.